Welcome to our group project, Community Health Assessment of Onslow County, North Carolina, presented by Colleen Bastiani, Madison Phillips, Cami Shabazz, and Larissa Sheffield. We'll start with a brief introduction of the project. Today we will be assessing Onslow County, North Carolina through a community health lens. We will be focusing on two main health issues, hypertension and suicide, and how they affect vulnerable populations, including older adults and the military population. First, we'll take a look at the county as a whole and dive a bit deeper into the Jacksonville community. We'll then discuss our community nursing diagnoses and tie all of our findings together. Onslow County was originally founded in 1739. Its county seat is Jacksonville, North Carolina, and according to the U.S. Census Bureau of 2019, its estimated population is 197,938 residents. As seen on the chart below, based on the demographic data from the U.S. Census Bureau, the majority race in Onslow County is Caucasian, making up 76.2% of the population. This is followed by 15.8% African American and 12.9% Hispanic or Latino. There are also small percentages of other races such as Asian, Native Hawaiian, or mixed race, as seen below. Based on the same census data, there are about 45% females and 55% males in Onslow County. Majority of the population is less than 65 years of age, with 33% being less than 18 years old and 57% being between the ages of 18 and 65. The Onslow County disability rate is 14.2%. Now this is really interesting when we compare it to the national average because it's much higher than the U.S. disability rate of 8.6%. Onslow County's violent crime rate is 19.4%, which is lower than the national average of 22.7%. While the violent crime rate is lower in Onslow County, the property crime is at 55.3%, where the national average is 35.4%, so it is much higher. It's also important to note that 52% of residents own their own homes. And the median value of owner-occupied homes is $153,900 according to the U.S. Census Bureau. Every 3 years, the Onslow County Health Department completes a community health assessment, and the most recent one was completed in 2018. Based on the results from that assessment, the top health issues that were noted were exercise, nutrition, and weight, other chronic diseases, and substance abuse. We'll dive a little deeper into this later in the presentation, but it's important to note that these are the main health issues as of now. Now let's talk a little bit more about the community itself. In this project, we focused on obtaining both primary and secondary data. Primary data is the data that researchers have collected themselves, while secondary data can be obtained through public documents, statistics, health assessments, state of the county health reports, or meeting minutes. Our primary data consisted of the windshield survey and a key informant interview. And for our secondary data analysis, we'll cover epidemiological statistics, demographic data, community health assessments, and access data. We'll start with our windshield survey of Jacksonville, North Carolina, which includes an overview of the county, housing information, food options, employment information, education, and healthcare resources. The community that we are focusing on is Jacksonville, which is the seat for Onslow County, which essentially just means that it's the administrative center of the county where government matters take place. It has an estimated population of 72,327, which ultimately means that 37% of the residents of Onslow County live in Jacksonville. It is considered a coastal city and sits on the base of the New River, and the primary zip code is 28541. It's really important to mention that Jacksonville is the home to Camp Lejeune Marine Base. This is the mainstay of the local economy and lifestyle and accounts for half of Jacksonville city residents. This is great because it provides a low cost of living to residents and a stable economy, but a disadvantage is it has little growth opportunity. It's important to mention employment as well. The county's unemployment rate is at 4.7%, and the poverty rate is 15.1%. Major employers in the county include Onslow County Schools, McDonald's, the Department of Defense, Food Lion, Domino's Pizza, Walmart, Taco Bell, Bryn Mawr Hospital, the City of Jacksonville, Onslow Memorial Hospital, the Marine Exchange Services, and the Marine Federal Credit Union. One way to get a general assessment about the look and feel of the community is to look at the housing. Jacksonville is a city which has grown up around the Marine base, and a lot of the housing reflects this demographic, with half of the housing being rented by military personnel. Rent, according to the U.S. Census Bureau, is usually between $440 and $989 monthly, whereas the average monthly mortgage is $1,287 to $1,558, making the cost of living about 15.7% lower than the U.S. national average. Another good way to assess a community is by looking at the food options available. Now, when you drive around Jacksonville, you can tell that majority of the food is going to come from grocery stores, restaurants, and a lot of fast food options. There are also state-funded food assistance programs such as food stamps and the food bank. However, majority of the food available is going to be through fast food options. Another thing we wanted to consider when assessing the community was its education. Onslow County has 42 public schools and 10 private schools, all ranging from pre-kindergarten up to 12th grade. There are also colleges such as Onslow Community College, Miller Mott College of Jacksonville, and Coastal Carolina Community College. It's also important to note that of the residents 25 years or older in the county, 91.1% of them do have a high school degree, while only 23.3% have a bachelor's degree. Lastly, we wanted to focus on the healthcare resources available around Jacksonville. So driving around, you will see that it's definitely a unique place due to its military presence, and there are definitely several health clinics both on and off base, and there are a lot of health care systems that are available off base to the public, such as hospitals and outpatient clinics, which we'll discuss a little bit further later in the presentation. It is also important to note that with 1 in 4 people living in rural areas, transportation troubles can create a barrier for care for some of the residents in this area. Key informant interviews can be a great way to get an understanding of a community by speaking with somebody who lives or works in the community. We interviewed Dr. Sean Sue, a neurosurgeon in Jacksonville who is currently affiliated with Onslow Memorial Hospital. Dr. Sue has over 34 years of working experience in the medical field, with over 20 of those years working directly in Onslow County. He has treated thousands of residents in this area and was a great resource for this project. As mentioned previously, the community health assessment showed that some of the main issues in Onslow County were related to chronic conditions. When we asked Dr. Sue about the high-risk populations, he gave us some really great insight. Based on the patients he treats on a regular basis, Dr. Sue said that the poor food choices, especially the high levels of fast food options, combined with high levels of hypertension, as well as cases of high cholesterol, all lead to an increased risk for stroke. He said because of this, stroke education and prevention has been a huge focus in this community, such as teaching people the importance of FAST, facial drooping, arm weakness, speech difficulty, time to call, to help improve patient outcomes. He also mentioned that a large percentage of his patients and the population in general has hypertension, and that a good majority are not even aware that they have it, and that's why it's called the silent killer. He noted that a lot of people in this area do not have a primary care provider established and don't seek medical attention until an issue arises, which is definitely a concern when it comes to preventative care in this community. We then asked Dr. Sue if there were any other leading health issues he felt were significant in Onslow County based on his experience. Dr. Sue said that post-traumatic stress disorder, PTSD, is very prevalent around Jacksonville and Onslow County in general, but that it's not talked about enough. He believes that these soldiers come home from overseas and do not receive adequate mental health care. This is also backed by the State of the County Health Report that concluded there were not enough adequate mental health facilities in this community. He mentioned that there are a few places and several different therapists, specifically on base at Naval Medical Center, there is a therapy center. But the problem that he has found is that a lot of military personnel aren't going to seek therapy. He said that therapy needs to be offered and it needs to be normalized. He also mentioned that there's a reason Onslow County has a higher suicide rate. PTSD in our vets and young military members is leading to high suicide rates. Now let's dive a little bit deeper into our secondary data. Jacksonville has a population of 72,436 according to the 2019 U.S. Census Bureau. While the male-to-female ratio for Onslow County was closer to being pretty evenly split, in Jacksonville specifically, majority of the residents are male, with about a 1-to-3 female-to-male ratio. This is heavily due to the military presence. The race demographics are not very different than Onslow County in general, with Caucasians being the majority race in Jacksonville, followed by African American and Hispanic populations. The Jacksonville disability rate is 12.7%, which again is much higher than the national average of 8.6%. If we recall, the Onslow County disability rate was 14.2%, and it's believed that these rates are higher because of the military presence in the area. And again, similarly to Onslow County in general, majority of the population is under 65 years of age in Jacksonville, with 94% of the population being between the ages of 0 and 65. According to the 2018 Onslow County Community Health Assessment, the median household income in Onslow County was $46,786, which is a couple $1,000s short of the North Carolina average. And while the median household income in Jacksonville is lower than the North Carolina average, the persons with health insurance is actually higher than the North Carolina average. This is due to the military presence in Jacksonville and the availability of Humana TRICARE to all service members and their families. We mentioned previously that every 3 years, the Onslow County Health Department completes a community health assessment, so we'd like to revisit that for the next pieces of data. According to the 2018 Community Health Assessment, the top quality of life issues voted by the community were substance abuse, low income and poverty, lack of inadequate health insurance, and lack of community support. These survey results were pretty interesting when we consider some of the data that we just previously discussed. So let's dive a little bit further into the leading health issues in this community and how we can address them. So the health department reported that the top 3 health concerns they wanted to focus on were exercise, weight, and nutrition, substance abuse, and other chronic diseases. On the screen, you'll find the top 10 leading causes of death in Onslow County according to the 2019 State of the County Health Report. Based on the information we found through the windshield survey and the informant interview with Dr. Sue, we'd like to focus on the number 2 cause of death, heart disease, and the number 7 cause of death, suicide. According to countyhealthrankings.org, in 2020, Onslow County was ranked 26th out of 100 counties in North Carolina when it came to health outcomes. The rankings consider physical factors such as physical inactivity, obesity, smoking, and excessive drinking, clinical care such as the lack of insurance or availability of types of physicians, and social and economic factors such as education and employment, all the things that we covered in our community assessment. But according to the report, Onslow County continues to struggle in areas such as adult smoking, adult obesity, excessive drinking, and premature deaths. Some common risk factors for hypertension are age, obesity, lack of physical activity, poor nutrition, and smoking. Knowing these issues that the community faces and the risk factors for hypertension, it should not come as a surprise that hypertension is the silent killer in this county and can lead to heart disease, just as Dr. Sue mentioned previously. While we previously mentioned that there is a large military presence in Jacksonville, it's important that we see the visual representation. As seen in the graph on screen, the proportion of residents in the military is higher in Jacksonville than in all of North Carolina. This is important to note for the next piece of information that we'll discuss. When we look further into the rates of suicide in this area, we find some pretty shocking information. Onslow County's suicide rate increased from 15.2 per 100,000 residents to 20.4 per 100,000 residents in just a few years' time. 7 in 10 of the population in Jacksonville is affiliated with the military, and unfortunately, the active duty population contributes to the suicide rate of the 18 to 34-year-old age bracket. Out of 165 deaths that occurred by suicide in 2018, 99 of them were from the 18 to 34-year-old age bracket. This is a terrible issue that is inflicted upon the younger military population in this area. According to Stanhope and Lancaster, like the concept of community health has 3 common characteristics or dimensions: status, structure, and process. Each dimension reflects a unique aspect of community health. So next, we'll describe Onslow County's community health status in terms of its status, structure, and process. We can assess a community by their health status through reviewing certain health indicators such as total deaths, suicides, rates of cardiovascular disease or cancer, accidents, and much more. As we just recently mentioned, based on the data for this community, Onslow County was ranked 26 out of 100 counties in North Carolina in terms of its health outcomes, taking all of these factors into consideration. When we are looking at the structure of a community's health status, we can look at things such as services, resources, and manpower. There are countless healthcare facilities and healthcare workers that Jacksonville and Onslow County in general offer to the public. The issue we found within this community is access to these resources. Whether it's a transportation issue, lack of medical insurance, or maybe a stigma surrounding receiving support, there seems to be a disconnect between the amount of services and the resources offered with poor community health status. According to Stanhope and Lancaster, there is a false thought that simply providing health care improves health. Such problems require cautious use of health services and resources as measures of community health. Lastly, we can assess a community's health status based on the process of effective community function or problem solving. We can look at different measures like effective communication, commitment to community health, management of relationships, and simply participation. While the county offers numerous resources, initiatives, and support for issues such as hypertension and suicide, there seems to be an issue improving the outcomes. The community of Jacksonville is the home to many Marines, and with the high suicide rate, there are resources out there, but they're just not often utilized due to the stigma that comes with mental health issues. There's also this expectation that you have to be tougher when you're in the military, which is possibly a deterrent from seeking help. The same goes for hypertension. If the county is offering better food options or lifestyle and exercise classes, but the community lacks motivation to participate, then no change can occur. This lack of communication and participation from the community can be detrimental to health outcomes, and it's an issue that we have seen in Onslow County through our assessment. We have now covered all of our findings in regards to the community health status of Onslow County. So, where do we go from here? Well, let's review the top health concerns and how community health nurses can improve patient outcomes in their community. Based on all of our findings, the top health concerns in this community relate to hypertension and suicide. The vulnerable populations for these issues are both the older adult population in relation to hypertension and the younger military population and how they relate to the rates of suicide. It's important that we take a look at some overall community strengths and weaknesses related to both of the top health concerns. One strength of the community includes the fact that there are a plethora of community healthcare resources, programs, initiatives, and educational programs available to the public and the military population. Another strength of the community is that over 90% have a high school diploma, and the unemployment rate is at 4.7 compared to the national average of 11.1%. And lastly, because of the large military population in the county, there is a very strong sense of community. One weakness that exists in Onslow County is that while many resources for mental health issues exist, there's a negative connotation associated with asking for help, especially in the military population. There also seems to be a lack of motivation to lead a healthier lifestyle, as seen by the push for the community to focus on exercise, weight, and nutrition as the top health concern from the community health assessment. Lastly, we found a disconnect between reality and perception in the community. For example, when surveyed, residents stated that one of the main concerns in the county is access to medical insurance. However, statistics show that over 90% of the population in this county are medically insured. We also saw this with their concern for lack of community support. There are plenty of resources and points of support available, but residents don't seem to know about them based on these results. So based on all of our findings, these are our top nursing diagnoses for Onslow County. The first is deficient knowledge related to hypertension as evidenced by poor lifestyle factors, lack of preventative care, and high rates of cardiovascular disease and stroke in Onslow County. And second, potential for increased mental health problems related to dense population of combat Marines, lack of support, and mental health stigma, as evidenced by high suicide rate in military community and suicide as the 7th leading cause of death in Onslow County. Now that we have identified the top health concerns, vulnerable populations, and top nursing diagnoses, let's take a look at the role that we, as public health nurses, can play in improving community health status. We'll look at our nursing diagnoses for both hypertension and suicide and provide primary, secondary, and tertiary interventions for each. For deficient knowledge related to hypertension, our primary intervention will be to encourage a healthy lifestyle. The secondary intervention will be related to blood pressure screenings, and the tertiary level will involve educating patients who have been diagnosed with hypertension on available resources in the community to help manage the condition. Let's talk a little more about these interventions. Encouraging a healthy lifestyle can be done in many ways. The Second Saturday Step Up program encourages residents to take the second Saturday of each month and do some physical activity. There's a Facebook group dedicated to the program and can keep residents up to date. What's Your Next 10 is an initiative that combines education and health screening with goal setting to help residents get healthy. It encourages residents to think about the goals that they have for the next 10 years, 10 meals, or 10 miles walked, and the level of health that they need to reach those goals. Secondary intervention involves screening blood pressure. This can be done at home with the Check Change Control online self-monitoring program. This program uses blood pressure readings taken at home to help participants achieve and maintain a healthy heart. It even connects them with a local educator who can assist them in the process. We can also do monthly blood pressure screenings at various pharmacies, healthcare facilities, or community centers to assist the public with regularly checking their readings. As mentioned in the interview with Dr. Sue, many residents do not even know that they have high blood pressure, so it's important that we screen as many people as we can. Many resources already exist in Onslow County to help manage hypertension. We must focus on educating patients on what resources they have available. This can be done through posting on social media, having weekly or monthly classes on hypertension management, or encouraging more people to enroll in the Check Change Control program. For the potential for increased mental problems such as suicide, the primary intervention is to focus on reducing risk factors. Secondary interventions involve crisis training, and the tertiary level includes ongoing support for survivors. Let's dive a little deeper into each of these interventions. Some primary interventions that can be done to reduce the risk of suicide include question, persuade, refer, gatekeeper training, abbreviated as QPR training. QPR training teaches the layperson warning signs of suicide and how to get help, which can help people address any immediate risks. Another necessary intervention and a huge issue in Onslow County is education regarding the stigma surrounding seeking help for mental health issues. By raising awareness and normalizing things such as therapy, we can help to address these issues before they occur. As a secondary prevention, the community must be prepared to take action if they or someone they know may be contemplating taking their own life. QPR training can also serve as a secondary intervention because it can be used to train people on what to do in the case of an emergency related to suicide. The suicide prevention hotline must also be a common household number so that people are prepared during vulnerable times. Lastly, it's so important that as a tertiary intervention, we provide support to those who have been impacted by failed suicide attempts, as well as those who have lost loved ones to suicide. Onslow County has a group called the Jacksonville Survivors of Suicide Support Group that is facilitated by a clinician and is a way to offer support from one survivor to another. Community is so incredibly important, and we must continue to help each other both through and after these hard times. With all of these interventions, the overall goal is to reduce the incidence of suicide in Onslow County and create a strong, supportive community. And finally, some concluding thoughts. This project has given us the ability to not only gain an understanding and appreciation for community health assessments, but also how public health nurses play a huge role in the health of our communities. Through assessment of Onslow County, we have been inspired to bolster engagement in our own communities and dedicate our time to educating and helping others. We can utilize these lessons in both our everyday lives and nursing practice to be better nurses and neighbors. We really appreciate you taking the time to view our presentation. We hope that you learn more about how community health nurses contribute to public health and the importance of community health assessments. We have referenced our sources on the following slides. Thank you so much for watching.